Hello, welcome to Gooncast.
Goon.
I'm accompanied by my co-host Jack today, and today we will be explaining CSFs, otherwise known as colony stimulating factors.
Welcome to our guests here, to our listeners.
To start off, I want to ask a question. Do any of you guys have any knowledge about colony stimulating factors?
No. Alright, so colony stimulating factors are glycoproteins that play a crucial role in the production and differentiation of blood cells, particularly white blood cells from bone marrow progenitor cells.
To elaborate on this, it's secreting glycoproteins that bind to receptor proteins on the surfaces of committed progenitors in the bone marrow, thereby activating intracellular signaling pathways that can cause the cells to proliferate and differentiate into a specific kind of blood cell for red blood cell formation.
Colony stimulating factors work by the immune system binding to specific receptors on the surfaces of committed progenitor cells in the marrow of the bones. So this binding activates intracellular signaling pathways, causing the cells to proliferate and differentiate into a specific kind of blood cell, like white blood cells. CSFs are essential for the development of various types of blood cells, including granulocytes, monocytes, and macrophages, which are crucial for both the innate and adaptive immune responses that play a vital role in the regulation of blood cell production, influencing the body's ability to fight infection and maintain homeostasis.
To clarify a better understanding of this, colony stimulating factors work by connecting to receptors in the cells in the bone marrow. They play a big role in blood cell production to protect your body from various numbers of cautious infections and maintaining a good, healthy lifestyle.
Common use for colony stimulating factors are supporting patients during chemotherapies. Like if they have cancer, they need treatment for it. They need to have like blood cells that are able to help keep their body healthy. So like it mobilizes stem cells for bone marrow transplants, and it increases white blood cell counts, which helps to mitigate the side effects of chemotherapy for those patients.
And some brand and generic names are brand is Rolvedon, Rizanuta, Epotin Delta, and the generics can be Figratin, Pelfiguratism, Efleprigatism, Fatmemogratism, Balocratism, Ariadopiantin.
These drugs can help in multiple ways by increasing white blood cell counts, preventing infection, and supporting stem cell mobilization, enhancing patient compliance as well.
Okay, how these work are for increasing white blood cell counts, the CSF stimulate the bone marrow to produce the more neutrophils, which are essential for fighting infections. This is particularly beneficial for patients undergoing cancer treatment who may experience low white blood cell counts for neutropenia due to chemotherapy or other treatments. And then for preventing infections, it's by increasing the number of neutrophils. CSFs help to reduce the risk of infections, which can be significant for the concern of patients with cancer. And then to support stem cell mobilization, CSFs are also used to mobilize stem cells for bone marrow or peripheral blood transplantation, aiding in the recovery of blood cell counts after treatments. And then enhancing patient compliance is long-acting forms of CSFs such as Pelfiguratism offer convenience by allowing for less frequent dosing, which can improve patient adherence to treatment regimens.
Some side effects and patient counseling tips. So side effects of CSFs are bone pain, fever, fatigue, injection site reactions, headaches, rash, and edema. Some counseling tips are educating the patient on the purpose, discussing the side effects, assessing the risks and benefits for the person of like whether it's really good for them to take it, providing support, and encouraging participation in the treatment.
The benefits for risk in justifying why the therapy is used despite the side effects is the
rash and edema. Some counseling tips are educating the patient on the purpose, discussing the side effects, assessing the risks and benefits for the person of like whether it's really good for them to take it, providing support, and encouraging participation in the treatment.
The benefits for risk in justifying why the therapy is used despite the side effects is the benefits of CSS are reduced risk of infections, improve quality of life, and maintain treatment schedule. The risk of CSF is the side effects that may be caused by CSF. The reason why it's used despite the side effects is because they can significantly reduce the risk of infection and improve the quality of life for cancer. Patients undergoing treatments that can lead to neutropenia.
Some ethical and social concerns can be potential risks, issues with informed consent, monetary compensation. So like, it can cost quite a bit, and the patients might not be compensated for that. Advocacy for donors and experimental use of the treatments.
And two common myths or misconceptions can be, the first myth is CSFs are only used in cancer treatment, which the reality is they are used in various medical treatments, including supporting patients during chemotherapy and mobilizing stem cells for bone marrow transplants. And myth number two would be,
CSFs are only effective in stimulating the production of white blood cells. The reality of this is CSFs also play a role in stimulating the production of red blood cells and other blood cells, making them versatile in medical applications.
and that's it for colony stimulating factors. Thanks for tuning in, and bye.